without the body, the mind is nothing. Without the body and the mind, the spirit is nothing. And
Bobby, your microphone is on.
Vimal sir, you are not audible.
And Bobby, your microphone is on.
Yes, sir.
Swallow an app. Swallow an app. Computer happy and 3 more to raise hand. Swallow an app. Computer happy and 2 more to raise
Insert
hand.
F4.
insert.
Insert GP F4 GP.
Zero. Page now. Swallow an app. Unloading JAWS. Quit JAWS. Enter. Meet hash evo hash GMXR hash X hash microphone. Recording.
I'm sorry, there was a technical glitch. So as I was speaking, uh, Mahatma Gandhi talked of cleanliness of body, mind, and spirit. So if we want a healthy body, we need a clean mind, we need a clean spirit, and the body, mind, and spirit, they have to be in sync with each other for a holistic human being to prosper and for a holistic humankind to prosper. So today we have with us Dr. Mamata Pradhan, who is a doctor in profession and also a public health worker. It's a privilege on our part to have Dr. Pradhan with us to speak on the issue of Swachh Bharat, the health and hygiene issues of children and the adolescents. Children and adolescents, as all of us know, are the future of the nation, and it's quite pertinent that we teach our children, we teach our adolescents the ways on how to keep hygiene, the way how to keep our environment clean so that we all prosper, the nation prospers in terms of body, mind, and spirit. So I request our uh, senior regional director to address us. But before that, I request our competent division to kindly play the IGNOS anthem. So over to our computer division to play IGNOS anthem.
Video on the screen.
Thank you, sir. May I now request our senior regional director, Dr. S.K. Tripathi, sir, to kindly welcome our resource person and welcome the participants and also to deliver the welcome address. Over to you, sir.
Uh, there was some technical problem in my computer. Therefore, I was logged out for a while. So I'm
May
sorry
I
for that.
may I request now Dr. Prabhatana, sir, to kindly uh, briefly introduce our guest of today's. Over to you, Prabhat, sir.
Okay, good afternoon to everybody. Respected Senior Regional Director, Dr. S.K. Tripathi sir, respected Deputy Director, Dr. S.K. Panigrahi, and Dr. B.C. Nanda sir. Am I audible, sir?
Yes, sir, you are audible.
Respected other dignitaries, my dear colleagues and friends. So I welcome you all to this online meeting. And the meeting is on the topic about Swachha Bharat, on the topic of Swachha Bharat Mission, key role to address the anemia of children and adolescent boys and girls. And for this topic, we have invited our research person, Dr. Mamata Pradhan. I am very fortunate to introduce her, though she is very popular and she is a very good health worker with master trainer. So we are very much thankful to you, madam, and we are very much thankful for accepting our invitation. So I welcome you, madam, to this meeting, and I hope everybody will enjoy this meeting. So, as a brief, let me introduce her. Dr. Mamata Pradhan is a very good social worker, and she has completed medical degree on Indian Medicine and Surgery from Balangiri Government Ayurvedic Medical College under Sambalpur University, Odisha in the year 1989. She is very expert in the field work also. She has done 1 year field placement at GGD Community Health Management Institute at Netherlands to study on the community health management at the Netherlands in the year 1995. She has also done 6-month field placement at Kandhamal Tribal District of Odisha as barefoot doctor for the promotion of community health program in the year 1997-98. So she has a very good achievement in this field also, and currently she is engaged in short-term assignment with SEED India, working in Assam Karmanja, Third Response Program as Public Health Work Expert. So voluntarily, she has worked everywhere in India, and as a trainer, she has trained so many health workers, and as on the job training, she has also got training from different reputed institutions like Indian Red Cross Society Delhi, Spear India, Oxfam Australia, Dr. Komlakar India, and UNFA New Delhi. And she has also done management training from Kal Kube Foundation and Red Cross Sri Lanka, Praxis India. She has also very good publications to her credit. It's a very good work that she has done. Amo Swachha Amo Hatare. Our health is in our hand. In Odia, it is called Amo Swachha Amo Hatare. So she has written this book, this handbook in Odia for the community of health worker and NGO. So this is a very good achievement, and we all should congratulate her for this great book. And she has also translated the training module on skills of safe home-based delivery for TBA, developed by Dr. Rani Bag, and she has translated that module into Odia language. So it's also another achievement for her. And she has developed hygienic promotion in IEC kit for school children of Bihar in Hindi language. She has also developed Susuma Ahara Nirogya Rahivar Pratha Adhar, a handbook for the field level of animators. And she has also developed fast card on do's and do nots, mice about menstrual hygiene practice for the Anganwadi workers of Odisha. So she has also developed posters on promotion of safe breastfeeding practice. So these are the very good achievements, and we are very much thankful to her for providing such type of service to the society. And she has also developed many promotional materials. And for all these works, she has been awarded, and she has received the award, Ananya Award from Government of Odisha for the contribution as humanitarian worker. This was given by NAWO, National Alliance of Women Odisha. So those are the different achievements, and to her credit, she has also published many national and international publications. He has published many articles in national and international journals on different fields, including the mainly the social health work. And she has the key responsibility now to provide technical hands-on training to the health worker. And she has been training to many social workers and NGOs. So these are the brief achievements about her. So anyway, we are very much fortunate to listen to her. So thank you, madam. And once again, I welcome you to this online meeting, and we are eager to hear from you. Thank you, madam, and welcome you once again. Namaste.
Thank you, sir. Thank you, sir.
Thank you, Dr. Prabhat, for your warm introduction, and welcome to our today's guest and research person, Dr. Mamata Pradhan ma'am. May I now request Dr. S.K. Tripathi, Senior Regional Director, IGNOR Regional Center, Bhubaneswar, to kindly welcome our today's guest, resource person, Dr. Mamata Pradhan, and all participants in the webinar, and deliver the welcome address. Over to you, sir. Thank you.
Thank you, Dr. Nanda. Thank you very much for inviting me to speak a few words about today's program. Before I proceed, I would like to welcome Dr. Mamata Pradhan, our esteemed resource persons for today's seminar, which is specially organized to mark the occasion of Swachha Bharat. So we are really fortunate that Dr. Mamata Pradhan is here with us. He has given her kind consent to speak on a very important topic, that is on health and hygiene of children and adolescents, on this auspicious occasion. I must also welcome all the participants, mostly our learners, academic counselors, and other study center staff members, those who are present today to witness this great occasion. I also welcome all our regional center staff, including the officers who have nicely organized today's program. So I welcome all of you once again, and I really feel fortunate to be to be amongst you to celebrate the occasion of Swachh Bharat. You all know that Swachh Bharat campaign is taking place throughout the country. And as per instructions from Ministry of Education, Government of India, almost all educational institutions are organizing one program or the other, since 1st September onwards. The activities will go on till 2nd of October, that is the Gandhi Jayanti. So the entire month, you all are witnessing lots of programs dedicated towards Swachh Bharat. You see, it's a really great mission, and this mission was started by our Honorable Prime Minister, Sri Narendra Modi ji, and with his initiative, cleaning campaign has been initiated by governmental organizations and non-governmental organizations. And especially in the educational institutions, this campaign has been accepted or adopted in a very, in a very bigger way. That means with lots of enthusiasm, with lots of spirit in the minds of the children, in the minds of the teachers, faculties, and other stakeholders. Everybody is plunged into this great mission and trying their level best to make this particular mission a success. So, as a citizen of the country, forget about that I'm a faculty, you are the students. Forget about it. So as a citizen or future citizens, we have a great role to play as far as this Swachh Bharat is concerned. So, lots of templates have been shared by Ministry of Education. Lots of instructions have come to us, and you must have also gone through all those instructions, posters, banners, essay competition, drawing competition, debates, seminars, workshops, cleaning campaigns, and plantation activities, and many more activities are being organized. And you'll be very happy to know that IGNOU Regional Center Bhubaneswar has also undertaken lots of activities, and we have been doing it. And our activity will go on till 2nd of October. In the recent past, we organized plantation program in our adopted village that is in Denganal district, that is Kukupangi. And we have also instructed all the learner support centers who are operating under the administrative control of IGNOU Regional Center Bhubaneswar to have this cleaning campaign in their respective premises. We have at the moment 53 active learner support centers, and in all 53 learner support centers, cleaning activities have been organized. There is some problem in the internet connectivity. I don't know. Am I audible now?
Yes, sir.
Yes, sir.
Yes, sir.
So please bear with me because there is some connectivity issue. So at times it is getting disconnected. So I'm getting it connected once again. So anyway, so activities are going on throughout the month, and as a conscious citizen, we are doing it, and we'll be doing it not only up to 2nd of October, but also in the entire, the days to come. Okay, because Mahatma Gandhi has taught us this particular lesson, that you live in a clean environment and keep your premises clean so that others will also imbibe this particular spirit from us, and the entire society will be clean, once the society or the environment remains clean, we will have a clean environment, and we'll live healthily, isn't it? We will live in a very healthy environment, and the diseases, the epidemics, and all these things will go away from us. This is the whole spirit. And you see, normally in the villages, you must have heard, "Ga parimala dhoba totharu jana jai." So this particular, things, small things are being spoken in the villages, and these are great learning points for all of us, because cleaning is very important. And friends, uh, there are 56 regional centers, and in all regional centers throughout the country, activities are taking place, and IGNO has taken the lead role. Today also, many regional centers are organizing webinars, including headquarters. Our School of Health Sciences is also organizing one webinar today from 3:30 p.m. onwards. So like that, lots of activities are being undertaken. If you think about the regional center, friends, IGNO Regional Center Bhubaneswar is one of the oldest regional centers in the country. It was established in 1986. University was established in 1985, and this regional center was established in 1986. That means it is one of the frontline regional centers in the country. And it is the mother of two regional centers in the state, that is Regional Center Angul and Regional Center Koraput. And taken together, three regional centers, there are 55,000, nearly 55,000 learners benefiting every year from Indira Gandhi National Open University, from our state only, from the state of Odisha. So in a way, I can say that Odisha is the biggest beneficiary as far as IGNO is concerned. And almost all academic programs which are launched by Indira Gandhi National Open University are available in this regional center. So there are programs for every category of learners. That means for every discipline, there are one program or the other. So IGNO has touched almost every discipline of knowledge and offered programs, and people are benefiting every year. And you see, our objective is to provide best kind of support services to our learners, through our study centers and through the regional center. Therefore, we are collaborating with various organizations, isn't it? Government of Odisha is one of the biggest partners of Indira Gandhi National Open University, and therefore in all government colleges of Odisha there are study centers, and in these study centers the in-house faculties of those colleges are the faculty members. They are providing academic counseling, they are providing academic support to the students, and we are providing administrative support, isn't it? So that way things are taking place and students are benefiting every year, because you see, education is has become a fundamental right, and with the help of only conventional institutes, it is not possible to educate all citizens of our country. Therefore, IGNO has come forward, and it has started offering programs through distance mode of teaching and learning, so that more and more people can join and educate themselves, isn't it? And thereby elevate the academic standards of our country. Once the country becomes educated, it will definitely become a developed country, because education is the key to success. It is the key to development. So our objective is to provide support. Our objective is to provide best kind of academic programs, vocational and professional development programs, skill development programs, so that people becomes educated and they contribute immensely for national development. In that endeavor, or in this particular direction, all are working. All the staff members of the regional centers, study centers, and all the stakeholders are working. And friends, I'm very happy that you all have become a part of this great mission, that is Swachha Bharat. And from IGNO side, you see, we are organizing various activities. Not a single program which are conducted by Government of India is there, which is not undertaken by this university. So almost every program which is developed or designed or conceptualized by Government of India is observed by this university, especially by the Regional Center of Bhubaneswar. So all the programs throughout the year, there are many programs throughout the year which are taking place, and we are trying to associate all our stakeholders, including learners, to make it possible or to make it successful. So I'll not speak much today because there are a lot of things about distance learning, about the program's availability, about the newness of Indira Gandhi National Open University, and so forth. Today is the time to listen to Dr. Mamata Pradhan, our eminent speaker. We know because in the introduction, Dr. Jena has already spoken to you that Dr. Pradhan is an eminent doctor. He is a great social activist. He is a great social worker, and he has done tremendous amount of work for elevating the standards of the society, helping people, helping the poor and marginalized. So she is here with us, and she'll be speaking about a very important topic about health and hygiene of children and adolescents. So with this, I stop here. In case of anything, I will definitely respond to you, but it is time to listen to Dr. Mamata Pradhan. So I would stop here and thank you very much for listening to me. And now I hand over the platform to Dr. Nanda for the remaining proceedings. Dr. Nanda, please. Thank you very much.
Thank you so much, sir, for your kind welcome to our participants and our research person and your very rich inputs that you have given to this webinar. Now it's our turn to listen to our today's research person, Dr. Mamata Pradhan ma'am. May I now request Dr. Pradhan to kindly deliver her keynote address on the issue of that is Swachha Bharat, health and hygiene issues of children and adolescents. Thank you, ma'am. Over to you.
Thank you. Thank you, everybody, all the dignitaries and the participants, my friends, giving me this an opportunity to talk to you. Let me share presently because my father was not ill, he was not well. He's admitted in a hospital, and I'm talking from his bedside. But I didn't want to miss this opportunity because it's a really a vital topic we are discussing, and I know you all will be the best anchor to take it forward. Am I audible?
Yes, madam.
Yes, ma'am.
Okay, thank you. Let me refresh your memory. December 2019 till 2021. The whole globe was struggling with a pandemic, the with the coronavirus. We all remember that that was the time we all struggled and our lifestyle was totally changed. But if you remember, to protect ourselves, to prevent ourselves from that virus, the two key things everybody was propagating or insisting to participate to practice, that was, one is the hand hygiene and second was maintaining the social distancing. So with this example, with this note, I'll go get into my topic, because if you see, to prevent ourselves from such a big pandemic, a small practice which is a hand hygiene and maintaining a social distancing, maintaining a distance from one person to another person. These two small practice, if we take it in a normal life, it's a very small practice, but that prevents us, that was preventing us from that also prevented us from that such a big pandemic. That said, how this, when we are talking about the Swachha Bharat mission, which was really launched in the year 2014 by our Honorable Prime Minister on the day of the birthday of our nation of the father, our father of the nation, the Mahatma Gandhi. Because Mahatma Gandhi was very much promoting to the Swachhata. And if you see, and our topic, today's topic is, we link the Swachh Bharat mission with the health hygiene issues of the young children and the adolescents. Okay. Let me give you some uh, data of the NFHS 5, National Family Health Survey 5, which was recently done. And there are two, three things coming very alarming about the children and the adolescent health. One was the malnutrition. Apart from all, there are many program has been launched to provide them adequate nutrition. We remember, we know there are Poshan Abhijan is going, supplementary food is going on in school, in Anganwadi center. Apart from all those programs is launched in the nationwide, still our children are suffering malnutrition, undernutrition, and the adolescents are suffering the severe anemia. Why I am talking about this? Because I will not take many of the example. I will confine to this example, and I'll try to link with this Swachh Bharat mission, how it can impact to reduce this issue, these challenges which the nation is suffering, the nation is facing. Okay. If you see, so when you talk about the malnutrition, sometimes it immediately it comes to our mind that it's not that the people who are the children particularly who are suffering of the malnutrition, they are not getting the adequate food. It comes because immediately when we talk about the nutrition, we link with the food. Yes, that is natural, we link with the food. Yes, that is also still a struggle to get the not the quantity of the food, because now that has been addressed, but the quality of the food. That's true. But still, still we are suffering the malnutrition, because there is another component, which is, if you see, whatever we eat, our body should have the consumption capacity to absorb all the nutrition. That is that part we don't talk much. We talk very much about increasing our quantity of food, increasing the quality of food, the, all those things, but we don't talk much about whether our body is capable to absorb whatever food is used, we are eating, the nutrition part, whether the body is. Let me give you a small example. I know when you get on scope, you talk to the pregnant mother, the lactating mother. Many of the lactating and pregnant mothers, they refuse to take the iron folic acid, because they have a lot of complaints about that. If we take iron folic acid, I'm giving a small example, we have so many complications. That means their body is not in a position to absorb the iron folic acid. Okay. Why I'm talking all those things? That means when your body is not in a position to absorb whatever you are eating, the nutrition component, and that has a link with the topic which we are discussing. Because one is, if you have helminthitis, which normally we call as the worm infection, and another, if you have the recurring diarrhea, recurring some waterborne diseases, so then body lost the capacity to absorb the nutrition part of the food. And it has a link with the Swachh Bharat mission. Similarly, our adolescents are suffering. It's a very alarming issue, the anemia, severe anemia. Let me go to the consequences, and then I'll talk to the Swachh Bharat mission. And my discussion, I will not make it very lengthy. Rather, I will request you to put your views, your questions, your queries, then it will be more in an interactive session. Okay. They, like when Swachh Bharat mission, if you remember, Swachh Bharat mission has a very pertinent their activities that was that they were very much focusing on improving the sanitation facilities the toilets, managing the solid waste, the cleaning the environment, less use of the or zero use of the plastic, and also providing the safe potable drinking water. These are the main components of the Swachh Bharat mission. It was in the Swachh Bharat mission 1, 2, and recently there are some more component has been added. But the primarily the focus was to ensure safe sanitation practices toilets in the school, family, toilets in the public institutions, everywhere, wherever the people there is a need of toilet, they should get a clean toilet. That is one. Second, the getting a safe drinking, potable drinking water. If you see, it's a very it's not a big thing, but still, in 2024, we are struggling to get these two basic facilities in in our doorstep, in our workplace. Still, we are struggling. Let's take the toilet. If you take the toilet, there are studies that for the dropouts of the adolescent girls from the school. There was one of the biggest causes was not having a proper toilet in the school. Many of us must have known because the adolescent girls during their menstruation they need a clean place to change to maintain their personal hygiene, which is not available in the school. Though there are a lot of improvement has been done, but still it was not adequate. It was not 100% done. So, it's a very simple thing. Not provisioning a safe, clean toilet to the adolescent girls in the school has ended with increasing the number of the dropouts. Okay. Once the dropout increases, that has another manifest that increases the young adolescent marriage. With one, the adolescent girls, they are not going to school, they are at family. So, there is a family pressure, or they themselves getting into some kind of because it's adolescent period, some kind of relationship, and they get into the marriage. And again, there is another issue: adolescent marriage and young girls getting into the early pregnancy. Even till in the urban, in the rural, we are getting the young adolescent girls within the age group of 17 to 18 having the first pregnancy, which has a biggest impact on, still we are not able to manage the infant mortality rate or the mother's mortality rate. So I'm sharing with the chain, not having a proper, there are many other reasons, but though because now we are talking about the Swachh Bharat mission and the activities which were very much abided in the Swachh Bharat mission, how important this act is to ensure that these activities should be done. Because in a small, not having a toilet ended up with has a link with the IMR infant mortality rate and the mother's mortality rate. Similarly, not having the potable drinking water. Still, in our country, the death of the children within 0 to 5 years is very much due to the not having the safe potable drinking water. Particularly talk about the diarrhea, talk about the jaundice, Still we have the polio in some pockets. Still we have waterborne diseases. Okay. If you take, okay, these are the diseases, we have the hospital, we have the health facilities, we can address them. Okay, we can address them. But it has a long-term impact. If we will have a recurring diarrhea, if we will have a recurring jaundice or malaria, so it has a other impact, which, like in a long run, it does not only affect to the health of the child, it also affect to the cognitive level of the child. Now you see, not having a safe potable drinking water ending with the death of the children due to the waterborne diseases, due to contaminated, the waterborne consuming the contaminated water, also it is affecting to their cognitive level. So, if you see now, our NFHS 5 also saying there are increase of the adolescents in adolescent crime. Adolescents are indulging to many negative practices like getting into the alcohol, getting into the drugs. It's a, if you see, yes, there are social impact there wherever they are living condition, those are also impacting to get into this kind of negative practice. But the choice, when you choose certain things, that is a cognitive, that really uh, try, that really uh, for, give a choice to your cognitive level. Like we, if I get a choice or you get a choice, what to do, certain positive things or certain negative things, definitely your cognitive level, your intellectuality will exercise and will give you a option. No, this is not good. This is not. This is good, and you will think of a long term impact. So those things we are not talking much, though, because that's why I tried to, I didn't want to miss this opportunity, because let's talk on those things. Mostly when we are talking about the health, we are talking about mostly the disease prevention, not talking about the well-being of a person, not talking about the preventive of a person. Because like a simple thing, if you see, if you have a vehicle, you are running a vehicle, and you will see, if yes, I have a good insurance, even if my vehicle gets accident, I will, through insurance I will get paid. But if your vehicle get repeated accident, definitely the capacity of that vehicle will be reduced. Similarly with our health, similarly with our body. This Swachh Bharat mission, the basic component, having a safe drinking water, having a good, with all basic facilities, a toilet, having a clean environment, are the basic requirement of a person, of a child, of an adolescent. Because why I am talking about child and adolescents, they are our future asset. We have to ensure all those things for them, because they are, because now the child or the adolescent, the young mass, they are not in a position to take the responsibility, but we are preparing them to take the responsibility for their family, for our nation. So in that case, when we are talking that our child should be grown up in a proper good environment, it's not only the school, it's not only the food, it's also a safe, clean environment, good water, safe, potable drinking water, a good toilet. If you see, so that is why, which I am quoting, I have wrote certain things, like I took some information from the NFHS 5, because I thought that it's a very good document. All the findings are very important, and it has a direct link with the topic we are talking about, the Swachh Bharat mission. Why it is important? Because still, if you see, uh, knowledge level, we have a very good information about maintaining the hygiene, the importance of the hygiene, not only the personal hygiene, food hygiene, let's call environment hygiene, everything. But still we are lacking with the practice level. Still, even if we are so educated, we know the consequences of using the plastic. We know the consequences of dumping the waste outside. Still, we are practicing because we don't see the impact immediately. That is the reason we don't see impact immediately because if I dump something, I'm not getting sick immediately, but it has a long term. We have now this is the high time to think on, not to think on this. If you take the report of the WHO World Health Organization, India is now overloaded with the diabetes, overloaded with the cancer, overloaded with the many lifestyle related diseases. If you see within the age of 40, being I am a doctor, I also become surprised to see a boy, young boy of age of 40, 35 to 40, coming with the complaint of diabetic or the high blood pressure, which normally we used to see after 60 or that particular that latter age. Everything, all those diseases we are talking, has a direct or indirect impact with the sanitation, good sanitation. If you see sanitation, it's because normally because I am working on as a public health expert, I'm working in different countries, um, and as I'm a humanitarian aid worker because I work in the disaster. Our first response is to ensure the um, to maintain to ensure the public health part, which has a great component of the sanitation, particularly sanitation and the safe drinking water, because it has there are many places where it has an immediate impact. Also, there is a long term impact. Immediate impact means you will see immediately the increased number of diarrhea, increased number of there are certain diseases which you see. But there are sorry, okay, sorry, sorry, because this is, I know this is the biggest challenge we face in this online discussion, online meeting. Okay. Let me give you another, because the 70% diseases, if you see, whatever, if you take the list of the common diseases which we suffer when we see the hospital, the 70% out of 100, the 70% of diseases which has a direct link with the either the sanitation or the contaminated water. And though it's a disease means it's also fatal. If you don't treat them in the right time, the life can go, like a diarrhea with the children, with the jaundice or the hepatitis or the cholera, all those things. It has also, it has a impact on the life, and it has a direct link with the sanitation on the water. So when we're talking about this, the Swachh Bharat mission, and the major component which I told you that is to ensure the sanitation, the drinking water, and the environment clean. So it has a, we have to, uh, it has a directly, when we talk about the hygiene, health and hygiene of the young children, we have to ensure all those things. And let's come to the practice part of this. Still, let me give you another one more example. Like I think it is very important to give you, yes, another NFHS report, which is very important. It is even not in the rural, even in the urban area, that major children are suffering the warm infection, which is called helminthisis, the warm infection. That was also another important issues, challenges, which NFHS 5 has been, they have highlighted that they are suffering the worm infection. Even the worm has a direct link with the sanitation, the personal hygiene, the environment hygiene. And it has a big consequences. Worm infection has ended with the lowering the or affecting to the immunity of the children and the adolescents. So let's see. It's a small example. If you take the example of the NFHS 5, the the issues, the situation of the country they have highlighted of the children and the adolescents, and it has a link with the Swachh Bharat mission. So the main purpose of the Swachh Bharat mission was not, it was to reduce the disease burden. It has the purpose was to improve the health and well-being of the, it's not only the children, everybody. It's, if we want to maintain a good health, it's not only you have to have a disease-free life, you have to have a physically, mentally, cognitive level, you have to have a good, fit, healthy and fit. And for that, you have a very good, we have a, definitely we have to give importance to the our environment, to our toilet, to our basic things, our water, our hand hygiene. I am very much sure many of the rural areas still we are talking about hand washing practices. Even in the institution, the schools, we are talking about the hand washing practices. So let us see. It's a very small thing, the hand washing practices. But this simple hand washing practices could prevent us from such a big pandemic. It's the high time to take this activity, the component of the Swachh Bharat mission to transform, to our lifestyle, daily lifestyle, which we were not doing, which we are still lacking. And mostly our children and particularly the children and the adolescents, they are very much lacking. Like take the example, adolescents, the food practice, because they are young adolescents, they are not getting into lots of this junk food or the street food. And if you see the quality, the hygiene is maintained in preparing the street food, it's horrible. It's really a big concern for the parents. So it's not only you or me, in every aspect, in every step, everybody has to look at the sanitation, the cleanliness of the whatever they are doing. Even if I'm cooking, even if I'm farming, even if I'm growing certain things, we have to look at the cleanliness. Like let me give you an example. In Mumbai, in big cities now, there is an alarm not to take much more vegetables or particularly the sag, the spinach, because the way they are growing the spinaches, it's in the open field. Still, there are big slumps. They are still going for the open defecation, and the drain water is released to the field. They're still releasing the drain water to the field, and the spinaches the farmers growing on those fields, we are consuming. Similarly, with the even with the cow milk, the grazing land, because it's anyway directly or indirectly, we are affecting to ourselves. It's affecting to the cycle of our health and well-being, the lifestyle. So this mission, when it was launched with a bigger concept that let's give more emphasis to the prevention of the diseases, promotion of the health. Not because earlier our more emphasis was on preventing the disease, preventing so more investment was on making hospital improved, making more medicine available to the patients, making all these apparatus in the hospitals available, so that still it is there, but the we saw we after by doing this we saw though it's not preventing the disease burden from the nation. It's not preventing the disease burden, rather disease is growing. We are addressing to the issues, we are not addressing to the root cause of the diseases, which is that we are lacking with the sanitation, proper sanitation. So there, this concept of Swachh Bharat mission, it came in a campaign mode, which our honorable sir was telling that there are a lot of awareness campaign is going on through different media, different mode of like essay competition, street play. There are many different modes are being used to propagate the importance of the sanitation. And because it has generating awareness, because once the people are aware about certain things, then it will change, it will come to their practice, it will definitely reflect to their practice level, and once it comes to the practice level, then that will be definitely, it will help to reduce the disease burden. It will not reduce the disease burden of the family, disease burden of the country, because the indicators which you are using, like infant mortality rate, maternal mortality rate, it has a global link. If we will not be able to reduce these small indicators like the malnutrition indicators, so then we have to have a certain standard in the global level. So when we want to meet at those standards, we have to reduce those indicators, and these indicators have a link with the direct and indirect link with the sanitation practices, the good sanitation practices, and uh, the other basic components of the Swachh Bharat mission. Take the example of the zero use of the plastic. We know we all are struggling with the global warming. We all are talking about the climate change and how it is impacting the plastic, destroying to our soil, our all the water bodies, all our environment. That we all know. Though we are talking all those things, but we have to bring it to in our practice level changes. So, uh, very briefly, uh, I wanted to share all those things, but now I'll stop for a while and I'll invite you people, if anybody has certain queries or certain things you want to put your views, it's most welcome. Then we can continue the discussion. Okay. I know another 18 minutes is there. So any queries, any questions, any views you can.
Thank you so much, ma'am, for your elaborate discussion and very rich inputs. I believe that our participants have benefited in a great way, and I believe that it has incited them and to ask queries. So I invite the participants for the discussion session, and please be very brief, introduce yourself, and please follow the floor rule that we will speak and allow others to speak as well. So if anybody else is speaking, we will not speak. So please introduce yourself and then ask your query very briefly.
Madam Namaste, am I audible?
Yeah, you are audible.
Myself, Dr. Priyanshi Tripathi, ma'am. Actually, I'm also Ayurvedic doctor, and I'm also passed from Government Ayurvedic College and Hospital Balangi. Uh,
Welcome.
yeah,
Yeah,
just
thank you.
recent in 2019 I passed, and I'm doing a Master of Arts Sanskrit from IGNOU, and this is my second year. First of all, I'd like to express my gratitude and many thanks to you, ma'am. Then, and I'm also very happy that a person from art professional and from my native Balangir also, I'm seeing you in this platform. And thank you so much. Actually, now I'm in hospital, and in that also, I'm very much interested. First, when I know that you are from our background, and there are many questions we can arise regarding this, but now I don't want to ask anything because hand hygiene and other menstrual hygiene and many things are there, and you described it very beautifully, and I think it is very helpful for all the listeners. And hope, ma'am, again we will meet in other meetings, and you will guide us properly. Thank you so much.
Thank you. Thank you. It was nice meeting you people, getting connected with you all. Yes, because normally what we see, uh, because still it is in our knowledge level, still it is in our, it has not been replicated to our practice level. It has to be in our practice level. Particularly, still we don't ask any street food prepare the vendor how you are preparing, what type of water you are using, and our
Yes.
children are eating, we are eating, and hand hygiene practice still it is a big challenge. We are not practicing, and you are being a doctor, you know
Yes,
how
yes.
it is. It's a
Ma'am,
very small
actually,
thing,
in last
but
in just yesterday and day before yesterday, we only face our NABH inspection, and in that they are describing like anything and what is difference between hand washing, hand rub, and very minutely actually they described us in normal people how can manage these things. So very nice, madam.
yes, yes.
There are two students who have raised hands, Ankita Behra and Bhagyasri Sahu. If anyone of them wants to ask question, they're welcome. Ankita Behra, if you have any question, you can ask. Umesh Chandra Sial, please mute your mic.
ସାଇକେଲ ଗୋଟେ ସାଇଡ୍ ରଖିବେନି କି?
Umesh, please mute your microphone.
ମୋର ସରିଯିବ ଏବେ।
Umesh Chandra Sial, please mute your microphone.
ଏବେ ତମେ ହେଲେ ଅଭାବଗ୍ରସ୍ତ, ଯିଏ ଅଭାବ ସବୁବେଳେ ତମକୁ ଗ୍ରାସ କରୁଛି, ଅଭାବଗ୍ରସ୍ତ ହେଲା। ଭୋକରେ ନ ଖାଇ ମରିଗଲି ରାଜା। Communal violence is caused by class of economic
ଟା କଣ କେମିତି ଏଫେକ୍ଟ ପକାଏ, ଯେମିତି ଆମର ସାନିଟେସନ, ତାପରେ ଡ୍ରିଙ୍କିଂ
Dr. Pradhan, you can continue because there is no other question from the students.
Yeah, I'm not able to to listen properly.
Yes,
What are the questions?
yes.
Can you repeat?
Excuse me, ma'am. I have one issue, ma'am. Hello.
Yes.
Please ask your question.
Ma'am, I newly admitted in the January section 2020 batch in MSc Chemistry. So till
Yes.
now, till date, I didn't get my all the books, ma'am.
Lakshmidhar, I think this is not the proper forum to address this question. We can do it another day. This is a webinar on health and hygiene issues. This is an altogether different platform. Ma'am,
You
you can
can
continue.
you can talk to us after the seminar, okay? Mr. Lakshmidhar, you can talk to one of us after the seminar.
Okay,
We
sorry,
will
sir. I'm sorry. Yes, sir. Okay. Thank you.
Madam, can I ask a small question? Madam, if you are listening to me,
Perhaps she's out for some time due to some technical glitch, sir.
okay. Yeah, there is a lot of disturbances happening, in the internet connectivity today. Till Madam joins back, if there is any issue which we can address, please speak up.
Sir, can I ask a question?
Yes, please. Please come.
Sir, actually, I have completed that registration process for the December exam. But just I would like to know that when our classes will be started
Which
for
program? Which program you enrolled?
Master of Arts Sanskrit, MA Sanskrit.
Madam, I will like to respond to you.
Yes, yes, sir.
Actually, we have our previous classes recorded and we have put it in the website. So if you send us an email to rcbhubaneswar@igno.ac.in, we will send you the link and you can download the videos.
Sir, yesterday I have already sent an email to all, and today again I reply on that email about the classes.
Today somebody has sent us an diagram and I have sent him or her the link. If it is link, I will send it to you. And it is some other person, it is I have sent it to him or
Yes.
her. So please, you have sent it to Asif Bhubaneswar today.
Yes, yes, sir.
What is your good name?
Okay.
Priyanju Tripathi.
Okay, I will check it and send the link to you. Please download.
Sorry.
Okay, okay.
Sir.
Dr. Bimal, Dr. Pradhan has joined back.
Yes, sir. I was
Uh,
disconnected. Now I joined. Let me give a logical end to the discussion.
Madam, a small issue. I had I would like to request to you. We all know that adolescence is a period of stress and strain, and during this particular period, the adolescents are fallible. They commit mistakes, and as far as this health and hygiene issue is concerned, there are a lot of things which they should be taught. So, do you have some points which can benefit the adolescents as far as health and hygiene is concerned, especially the children who are college goers, college or university goers?
Let me address that issue. Um, yes, adolescent girls. Let me take the example of the adolescent girl. The menstruation, the puberty period that was started, and when they are going to institutions, even if at home, they need a safe, clean place to maintain personal hygiene. They need adequate, good, potable water to maintain personal hygiene, which is still it's a big concern, even at the institution level, even at the household level, and that has an impact on uh, already I discussed about that the children, the girls, they get annoyed to go to the school during that period time. And if every month, 3 to 4 days, they get remain absent, and in a prolonged period, it has turned the, it has a link with the, it has get into the dropout of the adolescent girls. Oh, even if that is one. Second, even if they don't get proper adequate water, the if there is not all basic facilities like a hand washing practices, hand washing facilities, soap, a clean sanitary pad not available for them, so it has also another impact of in the reproductive tract infection. That is also getting more and more. We are getting it more and more cases of the increasing in the reproductive tract infection. That is one. And if you take in a different pocket wise, take the example of the urban slums, take the example of the rural area, where the water bodies now, if you see the, this mostly commonly they use the pond water for their personal hygiene, taking bath, all those things. But they dump all the waste also in the pond, and they are using the same contaminated water for washing themselves, for taking bath. Even if many cases they clean, they wash their utensils, the kitchen things also in the same pond water. But we dump all the waste also in the, even if they throw, if you see they throw the sanitary napkins, they throw all the waste, we all throw to the water. That is all. Take the example of the boys. Boys also, the boys anemia is also, the NFHS 5 says the anemia with the adolescent boys are also increased. And what was the reason? It's the poor maintenance of the personal hygiene. They don't maintain the personal hygiene. They don't maintain the hand hygiene. They are more indulging. They more attracted eating this all street food, the junk food, which is not safely prepared, and it has, and it is impacting to their health. So the health and hygiene of the adolescents, the young children, has a great link with the uh, sanitation practice. Let's take the example of the Anganwadi. Very simple, Anganwadi. Every village is Anganwadi. The way they prepare the food, from which source they take the water, whether the children are washing their hand with the soap before taking their meal, whether the children are washing their feet when they are going back to back from the Anganwadi center or before taking the meal. These are the very simple things which we have not been ensured till now. We have not been ensured. Yes, you have. These are the mandatory things we have to have ensured in our workplaces, in our institution. Even if in the public institution, even if in the public toilets, you go to the any bus stop or any the young adolescent girls, even if all the women, they suffer a lot traveling in a public transport because they don't have a proper toilet facilities wherever the bus stops are there, and it is not been properly maintained. So it is more not at the Swachh Bharat mission. It is it's not at more in the we have to give much more emphasis that it should reflect to our practice level, daily day to day practice level. Give me an example, small example of spitting or urinating outside. Still, it is rampant. We think spitting is a very simple, spitting has no issues. health issues. But still, spitting has a big health issues. There are doctors in our panel and our discussion. They will, we all know, but we spit everywhere. We also urinate everywhere. All those things, all those are our practice, which is coming from our either may from our ignorance, or we are not serious about this sanitation, safe sanitation. I It's both way. Many things we don't know that it has a great impact if we maintain the poor sanitation, and many things also, even if we know, we have not transformed into our practice. So we are suffering. Our country is suffering. Our family is suffering. It's our day to day, the health, the number of diseases are increasing. In spite of the very big hospitals, very good medicines, all good infrastructure, still the number of diseases is increasing, and there are many diseases which is not curable. We can't cure them. We have to carry it throughout the life. Also, so many times it will be fatal. And the basic things is the simple good sanitation, which is the core objective of the Swachh Bharat mission, that by aiming, by doing this in a campaign mode, it has a big aim to reduce, or the ultimate result is to reduce the disease burden and to upscale the health and well-being of these people of the nation. Okay. Any other queries?
Hello.
Yes.
Namaste, madam.
Yes.
Madam, nowadays, as the adolescents, many students are get affected by fungal infection. Is there any prevention they don't get fungal infection and this type of infection at generally 8, 9, 10th student?
Yeah, because look, because I'm working in the ground. Let me give you an example. During the menstruation period, and now we have a common practice of using the disposable sanitary napkin, because earlier in our age we were using reusable sanitary cloth, but now now we are promoting disposable sanitary napkin. Okay, but the sanitary napkin has a chemical content, and we have to change within 6 hours. Maximum 6 hours we can use. But when a child and a girl is coming to the school and there is no toilet, proper toilet, there is no changing facilities, she's in the school more than 8, 9 hours in the school. So it's a very simple example I'm giving. So she's not able to change a pad. Either she'll not come to school, or if she will come, she will bear with that pain. And the ultimate end result is there are rashes, there are chemical reactions, there are which you are calling the fungal infections. And so these are now increasing because we are not able to provide them a basic toilet with the water facilities or with the hand washing facilities. I'm giving this is a simple example. Similar things. We are not ensuring the hand washing practice everywhere in the school, particularly in the Anganwadi center, very small, because we are different level. We have to ensure these things. And why I'm talking about Anganwadi? Because once the child make it into practice, so they in the latter stage when he is going to school or wherever they will practice the hand washing. But we are not ensuring. Not a single Anganwadi center has been ensured with a regular hand washing facility. So the children, the small children, they are eating in that dirty hand, or they just wash their hands in a simple water, and they are consuming the food. Though we are providing them good quality food, they are getting good quality. The calorie is maintained there. It's written. So they are trying to maintain the calorie, but they are not observing it. That is which I told in very initially. Even if they are getting egg, they are getting peanuts, they are getting all the nuts, but their body is not absorbing because there is a worm infection. And the worm has came from their dirty hand and dirty feet. And because it was not washed properly. Even if they are getting the good food, but still the nutrition part, they are still under nutrition. There are wasting and stunting. So everything has a link with the sanitation, the swachhata. Everything. Look, take in our religion, in our every religion, take any religion. First, before starting prayer, you have to have the swachhata. Clean your dress, take a clean dress, wash your hand, wash your feet, wash yourself, and go to the prayer. I'm not talking about the religious part, I'm taking the spiritual part. Why it has been introduced there in the religion? Because many of the things through religion, they know we people are very much fear towards the God. But they use that fear and they try to put us into a very good positive practice of the Swachhata. That was the objective of Swachhata. Practice putting into to link with the two, make it a part of the religion, the Swachhata. Take any puja, the Swachhata. Start with the Swachhata. So, because Swachhata, maintaining Swachhata, practicing Swachhata is the best puja for our health, making our health healthy and and it's not only physical health I'm talking, because most of the time we don't talk about the mental and the cognitive health. If we will have the worm infection, that has an impact on our intellectual level. That part we don't discuss much more, or anytime we will discuss how it is impacting because the worm infection and all those things. What it has impact on cognitive level. If we want our child to be a healthy child, physically, mentally, intellectually, we have to give emphasis on. We have to ensure these all basic things are been. The child should get it at every place, everywhere, wherever he or he is going. Thank you. Yes.
Thank you, sir.
Sometimes we are travel in train, and that time, how will hygiene us?
Yes. I cannot give you ready-made answers because many times the people also ask me, Rajasthan, there is no water. How you are ensuring that you need good water? There, Gujarat, there are, but context specific. You have to have ensure that the sanitation part is we know better. We uh, looking at the keeping at the situation at the context, but we have to ensure that our sanitation, if we are traveling in a train or something, our sanitation part is maintained. Um, okay, like a simple example, like I travel a lot. I travel a lot because mostly because I'm a humanitarian person and I work in very challenging situations. I carry small things like soap always in my bag, hand washing, is a towel and something to even if the train, if I see it's not clean, I take extra bed sheet. Like these small things you can make it into practice. And but the most important thing which we have to raise the voice, which you are not using. So that's why I told you are the anchor. Whenever you see the street food, the golgappa, ask him whether you are using what type of water. And many times they just stand beside to a drain. Unless we raise the voice. If you see, because I know I am from Bhubaneswar, whenever I am traveling in auto, I see the auto wala speed. I just tell, don't do this, don't spoil this. So we have to raise our voice. We are not raising our voices. Wherever you are going, even if you are going with your children to the school, just ask the school principal, go to the toilet, see whether it is clean, whether it is maintained. We are not threatening anybody. We are not accusing anybody. We will become a whistleblower. Like, will become a whistleblower then only the changes will come. Because we are very silent. We don't talk much.
One thing I would like to add here, dear friend, you
Yes,
must have
sir. Yes,
noticed.
sir.
Uh, you must have noticed that in the trains these days, sanitation workers are posted. In every coach, you will get one or two persons who are attending the toilets. If you find that the toilet is dirty or it is not clean, so you can raise your voice, you can call somebody and get it clean. And at the same time, as madam has rightly said, these days lot of sprayers are available. You can carry a sprayer with you, because if you are a lady, then it is always safe. So if you go to any toilet, first spray the toilet and use it. So like that, small, if sanitation tips are, observed meticulously, I think there will not be any possibility of infections. So we have to understand, we have to, adopt our own ways of how to keep things clean and how to keep ourselves safe. So all these things are required.
Yes.
So
You
thank you.
see, which are the developed countries? They are developed because their sanitation part is very much
Yes,
ensured and
yes,
practiced. You go to Japan, you go to all those Scandinavian countries, their sanitation part is very much ensured. You can drink from the tap.
true,
So
true,
we
very
tell here the drink from the tap, but we cannot ensure. So those things, and we have, like we all have to be the whistleblower. We have to raise the voice. First, we will practice in our life and will become a role model for others and the whistleblower.
Madam, actually, I am very happy to say, and I am happy to share with all our friends present today, that the consciousness level has been increased to a great extent, towards
Thank
sanitation. Because,
thank you.
I used to travel in the train sometimes, and, I was finding people used to, eat groundnuts, etc., and used to throw that silka, etc., on the train itself. But these days, you will not find all these things. And even if somebody is doing like this, and even if you tell that person to clean it, you will not mind. If you just talk to that person in a civilized manner, then definitely he
Yes,
will accept it and he will clean it and throw the that dirty things outside. So these are the things happening. These are the
yes.
impact. These are the impact which is putting in the minds
And
of
that,
people, because of which lots of publicity campaigns, and because of NGO movement and government's steps towards maintaining clean environment in the society. So it is very important. And friends, you see, keeping our environment clean is not enough. We have to also teach people how to keep themselves clean. We have to act as a catalytic agent, for making the environment clean. So let us teach people. Let us tell somebody how to keep themselves clean, how to keep the environment clean. If you find somewhere something going wrong,
go to Mango.
definitely bring it to the
Mango.
notice of others. Thank you.
Yes, thank you, sir. Thank you.
Dr. Nanda.
So I believe that all the queries have been clarified, and I also believe that our participants go home from here not only to forget what they have listened here, but also to practice practice the rich inputs that we have got from a person who is not only a theoretician who reads books and sits in the classroom or teaches our students. She is a practitioner who blends her learning from the books with her learning from the field. And the benefit of a practitioner is that they are not tame and blind uh, theoreticians. They add the richness of the field to what they learn from the books. So, with the inputs that we got from a practitioner who is also a good theoretician, I believe that our participants go from here to practice in the field, in their daily life, the health and hygiene that we need to maintain ourselves, that we need to maintain for people around us, our children, our sons and daughters, our in-laws. So if we really practice those things in our day-to-day life, I think that will be the biggest success of this webinar today. So with great hope, with great optimism, I thank our resource person, Dr. Pradhan, and I also thank our participants, and I thank our participants doubly, just once for they being very patient participants, and the second for in anticipation, the second in anticipation that they practice what they listen today. So thank you all, and I request my colleague Dr. Santosh Kumar Panigrahi to offer the formal vote of thanks to everybody present here, those who have been instrumental in the organization of the webinar, to our research person, to our senior regional director who has been an inspiring force for all of us. So I request Dr. S.K. Panigrahi to kindly offer the formal vote of thanks. Over to you, Panigrahi sir.
Thank you, sir. It is my pride privilege to tender a vote of thanks. I extend my heartfelt thanks to Dr. Mamta Pradhan. No doubt, she is very busy, and also her father is suffered in disease and is hospitalized. So without so much difficulty, I mean, she accepted our invitation and presented today's, webinar. So I must thanks to ma'am from my core of my heart on behalf of the regional center, on behalf of our headquarters, and also on behalf of my all staffs. So thank you, ma'am. You accept our invitation. Thank you very much, ma'am. And also I thanks to our senior director. He always inspire us to conduct this kind of webinar and also seminar and symposium. And whenever we require any academic support from sir, sir is always there to support all the colleagues. Thank you, sir, for the able guidance. And thank you all the staff member, Dr. Nanda, Dr. Jena, and all my staffs who supported to make success of this webinar today. Last but not least, I must thank our participant, because without them, this program cannot be success. So thank you very much all the participants to attend this today's webinar. Thank you all. Thank you very much.
Thank you, Santosh sir, and thanks to all of you once again. May I now request our senior regional director, Dr. S.K. Tripathi sir, to kindly declare the webinar as closed.
Thank you. The webinar is closed for today. We'll have another occasion for a new seminar with a new topic. So till such time, we take leave of you. So I wish all the learners very best, and thanks our officers who have nicely organized the program today. So thank you very much once again, and the webinar is closed. Thank you.
Thank you all. Thank you all.
Thank you, ma'am.
Thank you, sir. Thank you.